We're going to provide you with in-depth orthodontic training on orthodontic brackets, arch wires, and obviously orthodontic tooth movement. SmileFast is the only system available that provides you with precise, predictable bracket placement utilising a digital indirect bonding system. And we know, as a dentist professionally, patients need healthy, functioning teeth. But what they really want is straight teeth and a beautiful smile. And SmileFast actually meets this demand and builds your practice. Because what we're going to do is give patients what they want, which is straight teeth and a beautiful smile. So Edward Angle, back in the early 1900s, described different malocclusions, and he described it all on the basis of the molar relationship. So in a normal occlusion, you'd have a class 1 molar relationship, where the molars, where the mesiobuccal cusp of the first molar articulates with the buccal groove of the lower first molar, and that was called a class 1 occlusion. And in other words, teeth fit together like a jigsaw puzzle. And the key tooth to look at is the canine relationship. If that's class 2, then as soon as I align these upper anterior teeth, these upper incisors will come forwards and we'll end up with a class 2 division 1. So in essence, all class 2 division 2s, once they're aligned, become class 2 division 1 malocclusions, and they will end up with excessive overjet. So the principle is, space is required to rotate anterior teeth, space is gained when rotating posterior teeth. And that's a very important principle to understand as we're going to go through the course. In addition to this, we also have our online case submission portal. So every case that will go through SmileFast will be placed onto our online portal, and we'll be able to provide you with an accurate treatment assessment as to whether this patient is suitable or not. But obviously the more knowledge that you have with SmileFast, the better it is for you to discuss with your patients and also to feel comfortable in treatment of these particular patients. We send them, this is the most important form that I think to send out, is a patient motivation questionnaire, and it will ask the patient, what do they want changed? Do they want their teeth brought forwards, brought backwards? Do they want their chin? Do they want any changes to their facial appearance, etc.? Do they want their midline changed? For example, if somebody says that they want their midline moved by 2 millimeters, I don't believe they're a SmileFast patient. I don't believe they are low-lying fruit. Do they want their teeth brought backwards? That would tell me they're more of a bimax protrusion, and we would need to have space to bring them back. Do they want their chin moved forwards, their lip moved? This tells me they're a very, very high maintenance type of patient if they tick all these boxes in the facial appearance. So this is a very important questionnaire. This will also be part of your informed consent, because it's happened to me where the patients have said one thing in the initial exam, and then 6 months into treatment they say, oh, I wanted this fixed and I wanted that fixed. So the first thing we need to do is to take photographs of the patient. And we need extraoral photographs, and if you have a look here, the 3 extraoral photographs that we recommend is on the right-hand side of the screen. We have a profile photograph. So once again, we can assess here the lip position, we can assess the skeletal vertical, are they dolichofacial, are they brachyfacial? The intraoral photographs, we basically want the right buccal, the center shot, and the left buccal. And we also like, if we can, from an additional point of view, half open photos. They show a lot to us, because now we can actually see the curve of speed that's present in the lower arch with the half open photographs. We can see if there's any cant to the occlusal plane. We can see the difference in the incisal edges of the lower anterior teeth. You want to keep the force levels light and continuous. You don't want to put heavy force levels on teeth, because it can actually slow down the tooth movement. But it's our immediate reaction when teeth don't move, let's crank up the force. But that is incorrect from a biological standpoint. And the optimal force is high enough to stimulate the cellular activity without completely occluding the blood vessels in the periodontal ligament. So we want to keep the force very light, because as soon as you put heavy forces on, you occlude those blood vessels which stop the osteoclast from forming. Welcome to pre-course video number 9, which is probably one of the most interesting sections, because this is going to discuss the basics of orthodontic brackets, arch wires and ligation. So we're going to put a shape activated arch wire, nickel titanium arch wire, into these braces. And as we do so, it wants to return back to its original shape. So it wants to go back to that flat wire. And basically, by changing the position of the bracket, we can change the rotation of the tooth. And we're going to go through this in far more detail with you in the 2-day course, but I wanted to give you a little bit of an understanding. So in other words, here, if we've got on the left-hand side of the screen is the pre-treatment position, showing the arch wire in place, and the tooth is going to move to the shape of the arch wire. We can see the tooth symmetry here. So I can click on a tooth, and I can see that now the upper left central is symmetrical with the upper right central. However, if I click on the upper right lateral here, can you see how the upper left lateral is not symmetrical with the upper right lateral? So at this particular point, I can make notes in my revision comment and say, please extrude the upper left lateral to the same position as the upper right lateral. And then I click revision, and it goes back to us to revise, and then we'll come back to you for an approval. Once you're happy with it, that's when the indirect bonding is fabricated. You'll be able to load the 3D viewer from the portal. You'll be able to print up your lab docket. You'll be able to ask questions about the case. All of your billing and invoices will also be shown as well. So if we open the case, and what you're going to need to, you'll see the details for the patient, you'll see the patient chief concerns, and this is basically purely the patient basic motivation questionnaire. But all of the responses will then appear down here on the case notes. So whatever you've written whatever question you've asked from us, and all of our replies will all be documented here. So you'll have a running commentary of all the help and all the questions on these case notes. Welcome to our pre-course video on debanding and retention. We use fixed or bonded retainers, and the ones we use a gold wire on the lower 6 to 6. Some people like to use the W-shaped wire for better periodontal maintenance, but there are some disadvantages that the wires are far more flexible because they've got more length of wire in them. But they can come with all different jigs to help with positioning of them. So you have a jig there. So what you would do here is you would etch and bond all the teeth, place the lower bonded on the teeth, and you would then go ahead and put flowable composite on the canines, take the jig off, and then put flowable composite on the other teeth.